Morning, everyone. Thank you for coming. I'm Dr. Sarah Moyer, Director here at Louisville Metro Department of Public Health and Wellness. We wanted to take this opportunity to give you an update on the Hepatitis A outbreak. I wish I could say that it's over, but that's not the case. Unfortunately, Kentucky has the distinction of having the largest outbreak in the nation, and Louisville is at around 540 cases. While we're seeing some signs that the outbreak may be slowing, there's still too many catching a disease that can be prevented. Hepatitis A is a liver disease causing symptoms much like the flu, but it can make you really sick. More than half the cases diagnosed have required hospitalization here in Louisville, and we've had 4 deaths. The virus in this outbreak is being passed from person to person, from poor hand washing, and we have no current evidence of being passed by food or drink, as was the case of the Hepatitis A outbreak of 1988 here in Louisville. Majority of our cases have risk factors of either homelessness, unstable housing, or recreational drug use, but recently we're seeing a growing number of cases in people with no risk factors, and have had cases in every single zip code here in Louisville. Anyone can get hepatitis A during this outbreak, but it doesn't have to be that way. We have a very effective, safe vaccine that prevents the disease. So everyone needs to get vaccinated, and most pharmacies and healthcare providers in the area do carry it. Any questions or more details of where to go, please check out our website at louisvilleky.gov/health. Today we have with us Dr. Jeffrey Howard, the Commissioner of Public Health of the state of Kentucky, and our own Dr. Lori Kaloya, our Medical Director, and Doug Thurman of the CDC. I'm going to first bring up Dr. Howard, the Commissioner of the Public Health for the state of Kentucky, to give us a statewide picture of the outbreak.
All right, let's see if I can get these. Is that good? Can everyone hear me okay? Perfect. Well, first let me thank members of the media for coming today. Your efforts in continuing to propagate public health message is absolutely crucial to helping us accomplish our goals of educating the public about issues like hepatitis A that are out there. So thank you for being here today. Thank you for reporting on the hepatitis A outbreak. As Dr. Moyer alluded, it is undoubted that hepatitis A outbreak has come to Kentucky. As you know, it's spreading across states across our country right now. Our particular outbreak has been genetically linked to that in San Diego and Utah. Interestingly, no states in between have currently declared an outbreak, and then Kentucky, we declared our outbreak. I do think there's other states in between that do have outbreaks and outbreak-related cases. However, for whatever reason, they haven't reported those, but it makes no sense that a whole entirety of a middle of a country will be blank and the disease spread across. So I do think that's an interesting point, that more information will come available as this outbreak continues to progress across the country. As I mentioned, our outbreak in the state of Kentucky is almost entirely related to those genetically linked to those in San Diego and Utah. However, there's a genetically unique strain in Michigan, and we have seen a few cases related to this strain in our western portions of our state, which we find interesting. In the future, science is going to go back and look at this outbreak, determine why hepatitis A began to spread across the country the way it has, and its particular modes of transmission. And I think that'll be a very interesting scientific endeavor in the future. As Dr. Moyer alluded, we have almost 1,100 cases in Kentucky. That's more than our 10-year average. We average about 20 cases per year in Kentucky, so it's a major outbreak. Luckily, this is a preventable disease. Hepatitis A can be presented by good hand washing practices, so we're not spreading the disease from one to another. Our general public needs to know that hand sanitizers are generally not effective. Rather, they should be washing their hands with soap and water and washing them for at least 20 seconds very thoroughly. And I know that the Louisville Metro Health Department has put out lots of information about how to participate in appropriate hand hygiene. Also, this is a vaccine preventable disease. So we have encouraged from a state level those who are at risk, so they have risk factors, which in this outbreak are homelessness, drug abusing populations, or some association with those populations, or you live in an outbreak area. So if you live in Jefferson County, we have recommended that you get the vaccination. Those recommendations are in line with our Centers for Disease Control, who is the nation's foremost expert on vaccines and outbreak responses. Dr. Doug Thurman, who works at the Kentucky Department of Public Health and is a CDC employee sitting here, will talk more about that. Let me talk a little bit about how an outbreak response occurs in the state of Kentucky. We have a system that has been designed where you have the State Department of Public Health, which is mostly an administrative body providing guidance and assistance to our local health departments. But local health departments, such as the Louisville Metro Health Department, are our action arms of public health. They do the work of public health. When people need vaccinations, when indigent folks need health care, all those things occur at your local health departments. And although it is the job and work of local health departments to respond in an outbreak like we have with hepatitis A, in these times of physical difficulty, it taxes the system. But for almost 10 months now, the Louisville Metro Health Department has mustered resources and efforts to continue to fight hepatitis A. And I think they deserve a warm round of applause for continuing that fight for almost 10 months. Drs. Moyer, Dr. Kaloya, Matt Rhodes, and many, many others here at the Louisville Metro Health Department has continued to lead. And what I'm most proud of is they've been a vocal advocate for other health departments across the state. And when I've needed help reaching other health departments and helping them develop their response to hepatitis A, they've been there, they've been ready, and they've been willing to assist. And I'm personally grateful for that effort. As a State Department of Public Health, we're going to continue trying to support local health departments. As I mentioned earlier, we're starting to see this disease spread into the more rural areas of the state, which I have turned my attention to now as a commissioner, and focusing on those areas, helping our rural communities develop a response that is both, when an outbreak is already occurring, is reacting to that response, but more importantly, being preventative in nature. So helping the folks in that area understand the risk of hepatitis A and how to prevent it. To date, we've almost given out $2 million from the State Department of Public Health, and we're looking to continue to help physically with the responses in local areas. With that being said, I'll turn it over to Dr. Sarah Moyer. Again, thank you for coming today. Thank you for all your efforts. And before I conclude, let me mention a couple names from the State Department of Public Health that shouldn't be overlooked. Drs. Doug Thurman, who's here today, Artis Hoven, Katie Meid, and the whole team, Epidemiology and Preparedness and Response, have worked diligently with many local health departments. That effort has been extensive. It's been time-consuming. I've asked a lot from my staff. As Doug knows, I pushed a lot, and I think we made a lot of progress, and I want to thank those guys for working so hard. Dr. Moyer?
So thank you, Dr. Howard. Now I'm going to bring up Doug Thurman, the captain in the U.S. Public Health Service and CDC Career Epidemiology Field Officer. Doug's going to update us on how the outbreak is affecting the rest of the country. Thank you, Doug.
Well, good morning. I have a few too many titles because I've been a CDC assignee here since 2002, so I'm also the acting state epidemiologist right now. So that I've been heavily involved in the hepatitis A outbreak. First, I want to just congratulate Louisville Metro on how much they have done. They have led the pack on how to respond to a hepatitis A outbreak, as Dr. Howard was saying. They've done a great job. I particularly want to mention Dr. Kaloya, who started, I think, literally when the hepatitis A outbreak started. She became the clinical director and so was thrown in head first in trying to lead this. Dr. Moyer was the new health department director at the time. Matt Rhodes been here for a long time, but he's done a stellar job, and Ray Zhao, their epidemiologist, have all done great work here. So I was asked to give a kind of national perspective on the hepatitis A outbreaks that are going on across the country. And right now, there's 10 states that have had widespread hepatitis A outbreaks. There's 9 still affected. California has closed their emergency response, but all the other states are still in some mode of responding to hepatitis A outbreaks. In this whole scenario, hospitalizations have been very high. For typical hepatitis A, the hospitalization rate is less than 1%. And in the past, we typically saw hepatitis A affect mostly children because they're the ones most likely to be putting their hands in their mouths and things like that. This is one of the first times we've seen widespread hepatitis A outbreaks in adult populations other than food-related outbreaks that come periodically. So hospitalizations, like in Michigan, it's been 81%, California 65%, Utah was 55%. We're at 57% hospitalization statewide right now. We were at 67, it's come down a little bit. Another thing that's really characterized this outbreak is that we don't get ahead of it until we really get our number of vaccinations up. And so I'll give you a couple examples. In Michigan, they've given over 200,000 doses of vaccine, and they're still battling it now. Theirs has been a 2-year outbreak. California gave over 188,000. We've given many thousands here, and Louisville has, I think, like we want to knock on wood when we say it. It looks like the numbers are starting to go down, but that's purely because of the amount of effort they've done to get those vaccinations out there. The at-risk populations, of course, are the homeless and the drug users. In other states, it started out mostly homeless and drug user populations got involved. In Kentucky, it's primarily a drug-using population. We have very few that are only homeless. Most of the people that are homeless also report drug use, so about 88% of our cases at this point report drug use of some sort. And that's not talking about just injection drug use, that's illicit drug use of any sort. So we think it's spread through person-to-person contact, just through lack of sanitary practices. A lot of people that are doing drugs are not washing their hands all the time, and they're trading drugs back and forth, so it's spreading through that population. So the homeless is not so hard to reach compared to the drug-using population. Of course, for homeless, there's homeless camps, homeless shelters, organizations like churches that work with the homeless, so we can target in that way, and Louisville's done all of those things. The illicit drug users are much harder to get to because that's a population that doesn't want to be found. They don't necessarily want to talk about what's happening, and they don't want to be reached, and they don't see health care that much unless there's an overdose situation or something like that. So the take-home message from that is for each community, they really have to focus on how do they reach the drug-using population in their community, because for every community it's different. Louisville has had a lot of success through a number of different avenues. One is the syringe access program, being able to offer vaccination through that. Another is through corrections. They worked for several months to get corrections staff trained and get vaccine available so that they could vaccinate in the jail, the county jail. So they've done well with that. There's substance abuse treatment programs that can be targeted, halfway houses, hospital emergency departments, because that's where you'll see a higher rate of folks with drug use as a risk factor. So across Kentucky, we're encouraging each health department, in fact, we just had a call about this a couple days ago, to really focus on who they can reach and how they can reach them through their different resources locally. The vaccination efforts that Louisville's put forth, I think, are what, like I said before, making the numbers start to fall now, and I think that's great, and that's really good for a city this size. I would be remiss if I didn't say, as a CDC representative, as Dr. Howard also said, hand washing and vaccination are the two biggest ways to prevent hepatitis A, and so we encourage everybody to really be diligent about hand washing and to get vaccinated through your private provider if you have insurance. All children attending school here in Kentucky are required to have the vaccination this fall, so that's going to keep our childhood population protected. And in an outbreak situation like Dr. Howard said that we're facing now, we recommend that folks get vaccinated in those high-risk communities. So I want to close by noting that the Kentucky Department for Public Health, invited the CDC to come up and do what's called an EpiAid in February. And what an EpiAid is when a CDC response team comes to a state to deal with an outbreak situation. And so CDC sent a team in early February. They spent about 2 weeks here, and they came directly to Louisville Metro and spent the 2 weeks here assessing what they were doing, looking at ways to improve their processes, and assisting them with data entry and surveillance and things like that. The key that came out of that was they came back to Frankfurt after their visit here, and they sat down with us and they said, we would just want to tell you, Louisville has set the gold standard for responding to these hepatitis A outbreaks, because the lead of that team had been to Michigan and California and Utah for all of their outbreaks, and they said Louisville was the most organized and had the best response ever they had seen so far. So they are really setting the stage for the rest of the country. So I just want to applaud them and thank them again for the hard work that they've done. Thank you.
Thank you, Doug. So up next is Dr. Lori Kaloya, our medical director. She's going to say a few more details about our outbreak here in Louisville, and then we'll take questions.
Thank you all for being here today. I know I've seen many of your faces throughout the last several months as we've continued to talk about hepatitis A here. As Dr. Moyer mentioned earlier, we are at currently 540 cases of hepatitis A here in Jefferson County, and that's since the outbreak was declared last November. We've had 4 deaths so far in the outbreak. Of the 540 cases, 338 have been hospitalized. That's 63% here, slightly higher than the rest of the state. As everyone else has mentioned, the outbreak continues to remain centered around those who use illegal drugs, as well as our homeless population. And that shift has occurred between initially more homeless individuals and now the population of individuals who use illicit substances. That has become the primary category of individuals who are affected by the outbreak. We've also mentioned that the primary means of hepatitis A spread is really through person-to-person contact. So if you share a cigarette, a joint, a drink, if you live with, or even if it's occasionally spend the night with someone who is infected, you are at risk of getting the virus. Because the virus can live on surfaces for extended period of time, it's really important that any businesses who have restrooms that are open to the public continue to use good sanitizing disinfection processes. And we do have some guidelines on our website that talk about the bleach and water solution that we recommend that you use in order to keep those restrooms clean. Thanks to a strong coordinated effort on the part of multiple people at Louisville Metro, we have some amazing planning personnel and operations personnel who've helped to coordinate these efforts. We have provided more than 78,000 hepatitis A vaccines here in Jefferson County. 16,000 of those are by health department staff alone. About 60, kind of switching gears here, about 62% of our cases here in Louisville have been amongst those who use illegal drugs. About 25% of our cases have been among the homeless, and about 3% have been among among the group of men who have sex with men. About 10% of our cases so far have fallen into a category that they do not have risk factors. So again, I know Dr. Moyer mentioned that previously. Dr. Howard mentioned that everyone in Jefferson County should get vaccinated, and we continue to encourage that. Dr. Moyer also mentioned earlier that there have been cases reported in every zip code in Jefferson County. We have seen clusters of cases in certain areas, including downtown, in the areas around Churchill Downs, the Dixie Highway Corridor, Shively Valley Station, and PRP, as well as the Portland neighborhood. We have made every effort to extend our reach to those locations when we see those clusters, but I think this just says that there's no place in Jefferson County that is not at risk. So regardless of where you live in our county, you should go out and get your vaccine and continue to practice good hand hygiene and hand washing practices. Again, we mentioned that we are starting to see somewhat of a decline of hepatitis A cases here in Jefferson County. I want to reiterate that that's not throughout the state, it's just here in Jefferson County. And we are hopefully optimistic about that, but this does not mean that our efforts will not be continuing. In fact, we will be continuing at the same pace as we have been with our vaccine efforts in the community. We have gone from about 4.1 cases per day reported in April, and now so far in July we're down to 1.67 cases. So we've seen less than half the number of cases we were up to at one point. So again, that's a good thing. We're hopefully optimistic, but we also realize that this can the caseload can go back up just as quickly as we've seen it start to go down. And our vaccine efforts have every bit to do with those numbers improving. This is no time to rest. We have now not only Kentucky, Indiana, Ohio, Tennessee, West Virginia are also experiencing hepatitis A outbreaks as well. And so we'll continue to have influx from those locations that we need to stay vigilant and continue to vaccinate and continue with good hand hygiene practices. I think that's it for me. And I'm going to hand you back to Dr. Moyer.
Yeah. So So thank you, Dr. Kaloya. Before I take questions, I just wanted to extend my gratitude to the state, the support from the state health department. Their partnership has been tremendous, but then also to our entire staff here at Public Health and Wellness. It's truly been a team effort. I know you've seen Dr. Kaloya and Matt's faces a lot, but can't thank the entire team enough. We wouldn't be here today saying we've got some good news with the trending down if it wasn't for them. Since the outbreak began, our employees have dedicated more than 5,200 hours just to the outbreak response, and we've invested more than $400,000 of our own money into expenses related to the outbreak. We've also had invaluable support from our community partners, Dr. Ruth Carrico and her team with the University of Louisville Global Travel Center and the Kentucky Nurses Association. They've provided more than 6,000 vaccines to local food and hospitality workers. And thank you to Aetna and Anthem for their donations to make it possible to offer those discounted vaccines to food service workers. Natalie Harris and the members of the Louisville Homeless Coalition who have helped us locate, educate, and vaccinate our homeless population. Also want to thank the volunteers in the Louisville Medical Reserve Corps who have donated over 300 hours to this response. And especially want to thank Nancy Kern, a nurse and associate professor at Spalding University, who herself has contributed almost 200 hours. She and her husband, Paul, who happens to be our emergency planner, have deep compassion, and the two of them have gone out into the community and our high-risk groups, personally spreading the word about the outbreak and these vaccinations. So all these volunteers have saved us thousands of dollars and have been able to get us to get to the population vaccinating much faster than if we were doing it on our own. Also want to give a thanks to Mark Bolton and Corrections, who have been an amazing partner and have vaccinated over 7,000 people, and Metro 211, who stepped up to be our call center to answer any community questions. So if you have any questions, please call Metro 211. And lastly, wanted to thank our pharmacies and healthcare providers in the community who've vaccinated thousands of Louisvillians, and our federally qualified health centers who've partnered and helped us vaccinating our highest risk individuals. So thank you to Family Health Center, Shawnee Christian Healthcare Center, and Park Duval Community Health Center. So with that, thank you everyone, especially thank you to my staff here again. We could not have done this, and I know it's been a tiring last 10 months, but thank you, and we are continuing to move forward as we battle this outbreak.
This has been a Metro TV production, a public service of Louisville Metro Government.